Hi, I'm Steffi Sear of Inner Insights. Welcome to your lymphatic drainage massage course. We're going to be going through a full body sequence. The session would take an hour when you're focusing on what you're working on a little extra. So maybe they've just had a mastectomy and you're going to do more drainage to the side that still has lymph nodes on it. Or perhaps it's post-surgery and you're going to work on that joint a little bit more. Or perhaps they have some kind of pain or inflammation with throat, ears, nose, and you might just do the head region, which is maybe a 5-minute massage, and you might just focus on that several times a day. You'll notice each time that it really helps to drain that interstitial fluid back down through the, here through the subclavian vein into the thoracic duct and then back to the heart. So as we get started, assume that we've already obtained consent, and we'll start with digestion or grounding in the digestion region, rather. Friction your hands together, removing yourself of any thoughts of the day. Be present fully for your client and for their highest good in your mind or out loud, depending on the comfort of you both. And your thoughts of, may this be for their highest good, and all that would like to assist are welcome to come through this vessel, this channel of light. As we begin communicating with our client and the hands-on, gently place your hands on the abdomen and ask them to breathe into your hands as you offer gentle compression. And after a little retention, as they slowly exhale, just lean into it a little bit. We'll go through the 4 quadrants of the lymphatic drainage. That first one was on the right-hand side above the hip bone. The second one is just under the rib cage, just under the gallbladder and the liver. The third one I moved to under the opposite rib cage, and that's the quadrant that would be more for this, where the splenic flexure is. So our spleen, and final quadrant is just above the left hand hip bone. So we're into ascending colon, a little bit of descending colon and sigmoid colon rather. And now those 4 breaths have elicited a parasympathetic response, got them into a place of rest and repair and healing, got us connected with our breaths, and we're ready to begin. We'll be beginning with lymphatic drainage through the collar, or rather subclavicular, just under the collarbone. As you go through palpations, palpate with your hands sideways so that if they're large-breasted, you're out of the way in the clear. To access the inner arm where the axillary and the subaxillary are, you might ask your client to place both their hands just above their hip bones, and that'll widen the gap between the breast and the axillary gland so you can get in there. Thank you. So I might go through 3 rounds of this at minimum. It's light, gentle palpations that are rhythmic in nature. And I'm using full hand contact, full fingers, trying not to be pokey with it, but gentle and smooth, and covering more mass with the full flat fingers. After I've opened up that channel, unless that was an area of congestion, whether it was rheumatoid, some kind of bronchial stuff going on, or mastectomy where they've had maybe a breast removed, well, if there was a breast removed, we'll go through that right now, and otherwise we'll move on. So knowing that if you need to do drainage to this area, maybe they've got lumpy breasts in general, this is a fabulous way to drain that out, as it's a detoxing organ, our breasts, and the lymph nodes in them, those mammary glands, can get swollen and tender with imbalance in hormones or dirty hormones. So lots of reasons for that in today's society, but it's a good thing for everybody to do to themselves regularly is manual palpations, just basically everywhere except for the areola, except for the nipple. So this is what I would encourage to go through. And you might ask your client's consent if it is something that they'd be open to do. Once you've opened up that channel, let's say there's no lymph in that channel anymore, you'll move it across the other way. But how I would ask my client's consent for this is a little different than just writing on the paper. So if they're coming in from a mastectomy, we would have talked about it already, but otherwise, if it's just part of lymphatic drainage, it's a wonderful addition, and it is one of our vitals. Arguably, your heart, your rib cage, everything is underneath there, so it's a great area to keep clear of toxins. And essentially, your lymphatic system is your immune system, so moving this out helps to move toxins out of the lymphocytes, which are your white blood cells. And as you're moving toxins out of your white blood cells, it's able to, your immune system is doing its job. It's flushing things out and strengthening your immunity in general from that detoxification. The elimination will allow each of the endocrine system to optimize their function by releasing the pressure off of them. So how we'd ask consent is basically saying all that in quick. Are you interested in having lymphatic drainage done to the thorax, the breast tissue area? I'll keep the areola, your nipple, covered at all times, and we'll be doing just one breast at a time. If you are comfortable, we can keep half of the breast covered while we're working the other half and then transfer over. Is that something you'd be interested in, Miss Jane? Sure, she says. So for a visual, you might have a face cloth or something soft. I've got a nice flannel cloth here, and I'm just going to cover that whole breast tissue area there, but lean your forearm over the clavicle as you take a corner of the under and pull back and down on that, and that allows you to expose. If you're going to open up the diaphragm to work that area after, we'll be doing it like that, but it allows you to maintain coverage here as you're pulling back the undergarments or the under, oh dear. All right, so as we begin into the main lymphatic drainage of the thorax region, we'll be going through subclavicular, which means below the clavicle bone, axillary into the armpit, and then subaxillary just below the armpit. And you can see I'm not using fingertips, but flat fingers. So we'll focus on that, and our fingers will be out with elbows in. Using that position, we'll avoid having you accidentally graze the breast tissue. So just to be careful with your draping here, we'll pull the top blanket down to just about areolae, about that nipple armpit line. And then you're going to reach underneath. You can palpate first to make sure you know that, yes, that indeed is their hand. And then just pull from the wrist or elbow their hand out. I bring the top blanket back and down, and then this bottom linen, I'm going to just pick up the corner of it, lift up their arm from the wrist and slide it underneath that tricep, right at the deltoid. Tuck their hand under that belly to keep them warm, or rather under that blanket, and then tuck them in so just the deltoid's exposed. So that way the linen is nice and snug. If you're going to move body parts around, these ones are not the ones you want to have jiggle and expose anything. So a nice snug tuck, and you can see as I pull it makes a nice taut line across there. And then just rest the elbow flaring out a little bit, and that'll make some space between the breast tissue and the axillary gland. So when you get in there with your hands, you've got a good amount of space to slide in. All right, then if this is above the clavicle, just roll it down a little bit. If it went too high, just give it a fold over. All right, so as we get started, you can use your oils now at this point. We're just starting to introduce our oil, and your oil blend might have some essential oils that maybe are good for lymphatic drainage. Any of the citrus help to drain. Certainly juniper is a great natural diuretic that can help to pull out extra fluids as well. Grapefruit oil is a really popular oil for lymphatic drainage, but honestly, you could also focus on essential oils that are flowers to help rebalance their hormones, or the woods. Perhaps if they have pain, this can seep in and act as a muscle relaxant as well. So there's a plethora of options here, and I'll send you some notes, a little bit of mini notes on essential oils that you can choose with a little bit more information. So assuming that you've got all that, we're starting elbows out, fingers in, and I'll just glide through and lean back, open up the neck, glide through, lean into it your second time, and then lean back. And as you lean back, you're getting a little bit of traction, lengthening in that area. So sweeping effleurage. And then we'll start into our palpations. Now that the oil is on, we're just leaning in for 1, 2, and 3, and then into the auxiliaries, into the armpit. 1, and then go a little lower, and then maybe a fist lower, so halfway down. And we'll do that again. Really light and rhythmic, maybe a pound of pressure. Imagine you're moving one piece of paper off another piece of paper. Just very light. So after we've palpated, assuming this isn't the primary concern, we're just opening up the main lymphatic channels. You might pump, 3 to a dozen times in this area. And right now we've pumped each place pretty much almost a dozen times, or a good half a dozen times, with 3 palpations to each round. So we'll move from there on to the next place, which generally I like to start by opening up the main lymphatic channel of the lower quadrants. So this area that we've just worked on really helps to drain into the heart, drains through the subclavian vein, goes through the thoracic duct and into the heart, and detoxifies those lymphocytes. Your lymph glands get swollen in an area when there's something going on, an overuse, too many toxins, an imbalance, and it's trying to bring those fighter cells to the area to really help to work out the extra load that's there. And so we're supporting it by flushing those interstitial tissues. This is the main focus. It flushes right back into the heart. The second one is the 4 quadrants of the digestion. So we opened up with that, but now we'll expose that digestive area and go through lymphatic massage with drainage specifically to those quadrants, so that you could work below the leg and have a really good opening, have a really good drainage happening in the lower limbs as well. So these 4 quadrants open up the digestion, and they're great for the bikini body, the sculpturing, where you'll see more of your ribs and more of the pelvic bone stick out, and it really lengthens the torso as it flushes that extra interstitial fluid out of the body. It also opens up the lower quadrant, so if you have a bad SI joint, if there's pain in the lower back and there's maybe some swelling around that area, or maybe it's your knees that are swollen, or maybe the ankles, all of these channels have to be opened by the ones above it first. And that's the go with this whole game. So in short, to show that in the arm, once you open up the main channel that area drains into, so the arm drains into the thorax, you're going to open up first by doing pumps to the closest area first. So the closest area to the heart, to the core, and assume I've done a dozen pumps to 3 dozen to each of these bends, every bend working proximal to distal, closest to the heart to furthest away from the heart. So I'm in the wrist now, and then I do the fingers. And that whole channel has been opened up now. And now I can drain each finger, if it was fingers involved in a sprain or a strain, or maybe something with volleyball or whatever happened, overuse, construction workers, and things are swelling. I can drain maybe a dozen times of a milking technique through that area, and then wrap around and milk the front a dozen times, in the back, and I start from above the first bend to above the next bend. So bring that fluid from above the carpal bones, above the wrist, to above that olecranon, above the elbow bone. And then take it from below the olecranon, cross that channel, cross the elbow, and take it all the way and milk into the axillary glands, into the armpit. And same thing with that posterior channel. It doesn't have very many lymph nodes in the posterior of the body, like supine, and supine's the front of the body. And we're going to work the whole front of the body today for the whole hour. Never turn them over for lymphatic drainage because there's not a lot of channels in the back. So you got to just sweep from the posterior to the anterior. Right? So keep that in mind when you're on the legs or on the bum. You're going to sweep it forward into the inguinals at the end. We'll see that in a little bit. But just to say, that's the whole thing. Once you've opened up this channel, you can work this area and above. So I can do, if you've got a cold or sinuses or any immune system challenges that are coming to play, flu, whatever it is, in the head region, you'd have to open up the lymph first and then go into the head region. If it was the arm, the elbow, maybe tennis elbow or a bicep tendonitis, I would have to open up this channel first and then pump the lymph nodes proximal to distal, closest to the heart, furthest away from the heart, and then do your crossover strokes, that milking technique from distal to proximal. So from one joint to the next, bring all that fluid from this joint through the next, and then from this joint, I'd be coming back into the breast tissue itself. Okay, so let's get going with the abdominal massage. Now that we've got that, we'll open up the quadrants there, and then the full lymphatic channels, the main lymphatic channels are all opened. So we've tucked into the bottom to expose the belly and keep the breast covered. We'll take another linen and we'll drape it across the breast, and we'll ask her to hold on to her breasts lightly with her own hands. So if your hands can just lightly hold on to that, and then I can take from the bottom sheet and gently start to tug and know that she's securing her privacy. And we'll take that linen, exposing the belly all the way down to the hip bone. So as you're tucking into around the pelvic on the sides, pull it taut across the other side and then tuck into that side as well. Let's get a little closer look here. Let's see, how does this stretch? Okay, I think we've got a good view here. We're always going to be starting on the right-hand side. I'm going to come over with my oil. I've got maybe 2 tablespoons of oil. And I'm just going to hold the digestion. And as I introduce touch, I'm just starting to vibrate. The vibration's coming from my pecs. So just engage your pecs, and a little bit of vibration elicits automatic relaxation. Usually at this point, if it's their first time, they might be a little bit nervous showing their belly. So I might have asked, let them know, I'm just going to expose your abdominal region. Are you comfortable with that? After we've connected with them and vibrated through the area, you're just going to start to pull from one side of the torso across to the other side. This massage can really elicit a lot of flatulence, and you want to encourage that that's okay. We've got a nice heavy blanket on you, windows are open, or whatever the case. We have an ionizer, a good air cleaning filtration system, and just let her rip. So don't hold in the gas, but let it out. This is a detoxifying massage, and that might very well be a part of it, and it's welcomed. Okay, so as you get started, after the pulling through above the hip bone on either side with your palms and flat fingers, you're going to start by compressing that lower, there's the hip bone. I'm going to use the side of my finger, and the other hand is going to hold the hip bone and kind of pull it back so that I can use the lateral aspect of my flat hand, and I'm just going to scoop. And this rhythmic scooping motion like a wave will just open up that first quadrant of the main lymphatic system drainage to the lower body. So everything from the belly button and below, actually everything in this whole diaphragm, digestion region needs these quadrants to be opened to get rid of the bloating in the area, to get rid of the swelling, to get rid of the interstitial fluid that's accumulating. So after about 30 of these, you'll go to just underneath the rib cage. I'm going to hold the rib cage with one hand, and the side of the other hand is going to come under. Flat hand scoops up. Again, maybe a pound or two of pressure. If you go too deep, you're actually into the circulation and you collapse the lymphatic system. So keep it light, slow, rhythmic. Lunge into it with your legs and find your breath. In general, you don't want to lose contact with the client once you've started. So you could lean over for that next quadrant, but leaning over the body is not the best ergonomics for your body. So maintain contact and just squeezing the feet. I might squeeze the kneecap as I make my way back over to the other side. So once you have contact, try and maintain it. You can see already in the video that nice indentation that happened here and the nice indentation here. So there was a bit of bloating for sure, and we can still see the bloating here. And we'll work through that with maybe digestion massage. We can show that today too. So this is the third quadrant. We're into the splenic flexure. This one was the hepatic flexure, which underneath it is the liver and the gallbladder. The liver has 800 functions. Its main one is to detoxify toxins from the body. Your gallbladder releases bile to help break down fat. Your spleen is a blood reservoir. It's also part of your endocrine system, so it can swell up and act up when there's something going on with the immune system. It's going to try and produce more red blood cells for you. It's going to try and build your blood, build your strength, your hemoglobin. So that's the third quadrant. I'm gently pulling down the rib cage to get a little bit deeper under towards the spleen itself, but still in that splenic flexure region. And the fourth quadrant. We're into the lower bowels, the descending colon, and the sigmoid colon. We've got a little bit of a shadow casting. Let me see if I can augment that a bit. So those are the four main quadrants, and that's pretty much it. It doesn't take a lot to open them up. But once they're open, if you want to do anything to this region, it'll happen so fast because it can drain through here, and then the aortic valve behind it'll go behind that and come all the way back up to the heart. All right, so from there we can start with the small intestines. If you did want to do a little bit of abdominal massage to support drainage in this area. The small intestine is around the belly button for 1 to 3 inches usually, arguably 4 inches if somebody's larger or if they have an expansion happening in that area. After circular clockwise motions with flat fingers several times, I'll start on the right hand side and I'll push down halfway between the belly button and the hip bone. That is the ileocecal valve, the one-way valve that connects your small to your large intestines. And I stayed on the valve for a little bit, and I might vibrate a second round through her exhaling and just gently gliding towards the hip bone, but I'd be at the top of the hip bone if I did get that far outwards. So medial to lateral, from center to out. So now we've opened up the small intestine a little bit with just those circles, and then opened up the ileocecal valve that connects the small to the large. So that large comes from hip bone to rib. That's the ascending colon. Once things move out of the small intestines, they come into the through the ileocecal valve and into the ascending colon. The base of it's your cecum, the human compost. And then from there you come up into that hepatic flexure. So the hepatic flexure itself, you can comb through, spend a little bit more times in curves. And then from that rib cage to the bottom of the opposite side, you're coming into sweeping through the transverse colon. And then from transverse, you can work that curvature of the splenic flexure, and then take it down the descending colon. So this movement in itself has just said, this is how your colon moves. And I'll just encourage peristaltic action itself. You might very well hear grr, 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 and just affirm it. Say, wonderful, we got things moving. Good stuff. If you want to go deeper with it, you can now petrissage in through, starting with the small intestine for maybe 3 fingers width. 3 petrissages, 3 small circular movements to each area around the belly button. So that was 1 full rotation of petrissages. And you could do 3 full sets. We're halfway through our second of petrissages around the small intestine. Your small intestine is where 80% of your nutrients are broken down. So if we don't have enough enzymes and probiotics in our diet, things might get a little tight in here and have a hard time breaking food down. If you have a lot of stress and your holding place for stress is your belly, things might be a little tight in here and move through a little too fast or a little too slow. Really, constipation and diarrhea are one and the same problem. Once you get things irrigating, you should have valve movements from your elbow to your wrist and the size of your wrist, once or twice a day. That's a full good clearing, a good irrigation. So from there, we've opened it up 3 rounds. We take it and sweep it across that one-way valve, that ileocecal valve that connects the small to the large intestine. And then you're going to pull up the ascending colon, and you could again go through all of the petrissages in these areas, and where you feel a buildup, which is usually in these flexures, you could lean back and pull through a little more. You can hold in that area with a little pressure, tap it to break it up. You could vibrate coming from your pecs and ask them to breathe into your fingers. Breathe, sending oxygen to this area to help move things along. And also encouraging them to breathe into the side bodies of their lungs. Nice deep breaths, filling full lung capacity. Can send a lot of oxygen and mindfulness to these areas to really be their biggest healer, to help things move along. So that's pretty much the petrissaging through the large colon and completing the abdominal massage. You're going to find most people have right under the rib cage on the hepatic flexure and the splenic flexure a little bit more of a buildup, as things can get caught and sticky, sludgy buildup in those curvatures of the colon wall. Colon wall is easily perforated by weight and incomplete proteins that create engulfing in an area. And so seepage can happen, and you can get leaky gut, which can create all kinds of other issues with health. So we're not going too deep, and we want to encourage lots of greens in the diet, lots of chlorophyll, lots of spirulina, having a good amount of rotation of enzymes. Maybe that would be from sprouts, maybe it would be from juicing wheatgrass, maybe it would be from high enzyme foods like pineapples, mangoes, kiwis, bananas. What else? What? Papaya. That's a great one, papaya. Yeah. So give a little grounding to this area, and now we're going to go into lymphatic drainage, moving everything from this quadrant up to the next. And this is part of the body sculpturing that can really open up on this area. So we're going to ask our client, and I might have opened up her linen wider at the beginning, and I didn't. And instead of grabbing it and adjusting it now, I'm just going to put a longer one across, and I'll ask her to turn her body, and she's going to rotate, and I'll show abdominal massage to one side. So we'll get you to rotate onto this side. Fabulous. We'll pull that draping down. And let me just pause this and I'll give a little bit more detail to this. Or maybe I can just move it like this, actually. Yeah. That way we don't have to start and stop it. Pillow between the knees. No. Under the head, and I'll get the pillow between the knees adjusted. So the pillow that was under the legs, I just ask them to spread their knees and let that pillow go all the way down to their ankles. And that keeps their hips in line, so there's no pressure on the hips. We'll open up this region by just pulling the draping back. And then this draping, I'm going to put under her arm like that. There. We don't need that layer anymore. Yeah, that gives a good exposure. So, I'm going to ask your client, I'm going to show this a little bit better like this, to lift their arm, and if it's comfortable, to drape it above their head. Okay. So as we move through these quadrants, you're just pulling up from the back and the front, up to the center. Milk that fluid up, flat hands above the hip bone, anterior and posterior. Let your knees bend, move into this so that you're not taking tension into your lower back. Let yourself sway from one side to the other. So after about 30 of these milkings, you'll do the same thing to the rib cage, just under. There's that last rib. I'm going to pull and contour. Okay. Pressure. Light pressure. Is that too much? I might have been using too much. Okay. Yeah, light and rhythmic pressure. Flat hands. Once you've done both of that side's quadrants from the posterior as well, if there was swelling into the lower back, I could pump right around the SI joint and anchor the hip bone. So I'm just bump, 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 making my way medial to lateral. And then after pumping to open it, I can sweep extra. So sometimes there's a little bit of swollen lymph nodes that you could just bring forward, and then we're going to take that anchor, lean back, and open up the torso as you milk that fluid up. So one hand retracts and the other hand leans forward, really making length. Visualize creating that length and opening up the torso, elongating it. And then from there, switch hands. Take the other hand. It'll get a little bit more of the front or the back, depending what hand you started with. And then take that fluid and pump it up into the axillary and into the subaxillary. My other hand, you can see, is supporting by holding the back of the arm so that I can pump and have resistance. Okay, and that's lymphatic drainage to the digestion. You could do that, you would do that on both sides. All right, we're starting lymphatic drainage to the arm. And I'm just going to apply a few effleurages of their oil. You could use or not use oil. Oil has a better glide and it's moisturizing, and it allows the benefits of essential oils to penetrate into their skin as well. So a few effleurages, palm into the armpit, and then lean back gently. You might give the arm a stretch, lean your body back. You can vibrate into the area. And if you'd like to give a little extra, you could walk all the way till the bicep touches the ear. That's a nice pec stretch, taking the wrist as low as the table. And slowly making your way back to T-bar position. If you wanted to go a little further, you could do a full arc, pulling the shoulder away from the ear. And leaning back gives a really great stretch. You could vibrate into it, which again is coming from the pecs vibrating. And here we go with lymphatic drainage. We're going to pump into the armpit with our palm and a little bit into the mastectomy, into the lateral aspect of the breast, the mammary glands. And we're pumping into the armpit and then below, full, flat, slow, light, rhythmic motions, making your way proximal to distal, closest to the heart, to furthest away, pumping the channels open. So we've opened up the axillary, the subaxillary. Here we're opening up the supratrochlear. As we go through the inner elbow, pump, visualize small, tiny grapes and just pump through. If you ever feel swollen lymph nodes, that's what it feels like, by the way. Feels like kind of puffy grapes that are a little bit blown up with air, a little bit gassed. So we can pump through the wrist next. As you're pumping through, you're in the carpal region, those carpal bones, just light palpations, a little bit of a milking downwards towards the heart. And then from here you can pump through the fingers at each of their bends, so roll your hands through. And that's opened up all the channels from proximal to distal. The whole channel is open to drain to the heart now. So now you could direct it to wherever you want to go. You're always going to start at the furthest place. So we'll milk the fingers, and we'll milk from above the wrist to just above the elbow, front and back, posterior as well. And you're milking, moving all that fluid. Visualize milking the fluid back to the heart. And then from the elbow to the chest. And you can even pump through that thorax region. So the only time that you wouldn't do the whole channel is if there was something going on that they came in for. It was inflamed, irritated, post-surgery. Those would be some examples. So let's say they had tennis elbow. They have inflammation in the elbow. I'll just drape, hold the elbow itself, and let the forearm drape over your forearm. So after pumping the axillary, the subaxillary, and the olecranon, I would just milk the posterior channel and the anterior channel, and that's it. So it is contraindicated to do lymphatic drainage below an area that is swollen from an injury or an irritation that is acute. So if you've got trauma, maybe you, I don't know, took a baseball to the arm and it got swollen. Maybe you fell on your elbow ice skating. And so you're just gonna milk on either side of the elbow, right? Milk that channel and then bring the fluid all the way to the main drainage area. And you're going to avoid putting too much pressure at all into anything below the elbow. So if you did do the lightest pressure, that would be great intentional work, but otherwise we'll avoid doing anything that could increase circulation to the area, would increase swelling and pain to the area as well. So try and avoid working below an area that is swollen. Although lymphatic drainage is so light, it's arguable. Palpate higher.
No, above the area. So if it's injured.
Yeah, so if something is injured, if it was the elbow that's injured, you would not work below that area. You're always going to stay proximal. So you can work above that area closest to the heart, but nothing distal, nothing below the area that is the irritation or inflammation post-surgery. So you'll notice that all of our strokes were one-way strokes. We're bringing that fluid, the swelling, the swollen toxins, lymphocytes, immune-boosting cells. We're draining the toxins from them back to the heart. One way only. Very light. That was arm massage. We'll go on to legs now. Okay, so now we're doing lymphatic drainage to the leg. You would do this in a full body sequence, or you could also do it individually if they had any injuries or surgeries, if they were post-surgery or pre-surgery. It's wonderful to open things up. So we'll encourage that first you opened up the thoracic ducts, the main lymphatic ducts that drain into the heart. Then you did the 4 quadrants of the abdominal region, and then you'd move on and do the leg in the full body lymphatic drainage, or if you're just doing specialty, make sure you still open up those 2 regions first, the thoracic and the abdominal quadrant, and then you're ready to go with the lymph on the leg. So we'll start by taking the linens and bringing them up. I'm going to remove the heated blanket, and we've got the blanket just above the inguinals, just above the crease of the upper hip. And we'll start by palpating, squeeze, hold, and release from the upper outer thigh, working your way down, around the knee, around the shins, and into the foot. So introducing touch before you drape. Then you're going to bring the linen in towards the midline. Sneak your hand under the knee, or you could just lift the leg up, is easier. And then just grab that linen and tuck it underneath so you get this nice snug tuck in here. All right, from here we're going to start by opening up the inguinals. You could do that manually, and it would be a palpation into the subinguals and the inguinals. So the inguinals and the subinguals. Oh my gosh. Then, not everybody is comfortable having that palpated, so I'm going to show how to open that up and the knee up at the same time. I'm just going to hold with my forearm on their foot. You'll note I kept the socks on because if they have cold feet, I'm not really going to work on their feet, or if I do, I can take the socks off at the end, keep them cozy. And the other hand just bends the knee, and I bring the leg up and back. So you're pumping the knee open, and make sure you hold under. You don't let the leg fully extend so there's no hyperextension in the knee if knee's an issue. So you might do this at least a dozen times or up to 3 dozen times if there's a lot of fluid buildup in the areas of the SI joint or the next joint, the knee, or the next joint, the ankle, or even the next joint, maybe there's bunions or arthritis in the toes like gout. So we've pumped open the first 2 channels at once here. Slowly and gently bring the leg back down, fully supported, and then you're going to pump the ankle itself. So the ankle, you're pumping medial and lateral from lowest, from the distal to proximal, to the top of the ankle, below the ankle, around it, to the top of it. Flat fingers. And I might pump that area maybe 20 times, 2 to 3 dozen times. She has a pillow under her leg, assuming for her it was her knee that was a little bit of a tender issue. So she's been overusing her legs, playing a new sport, she's playing pickleball, and there's a little bit of swelling in that area. So we've left the pillow below there, making the knee higher than the heart. Whenever there's something inflamed, whether it's your elbow, a tennis elbow, I might prop it up with a pillow underneath it, to keep drainage happening. So when you're in resting position, it's above the heart, which increases drainage with that inversion. We'll take our oil, and now that we've opened up the channels, we're just milking. It's that crossover strokes. So from below the ankle, and just scoot your socks down a little lower so I can get below the ankle, to just above the knee. You'll notice I'm going from one side of the knee to the other. I'm going lateral and medial on the lower limb as well. So on that lower leg, sweeping the inside of it and the outside of it with flat hands. And now I can sweep underneath and take the channels from under the knee and bring them up. And I can do milking over the knee on each of the 4 quadrants without touching the knee. So make sure that you either hover your palm above it or that you come on both sides of it. And then I also milk behind, so our popliteal glands are behind there. Milk, 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 and then bring it towards the milk, 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 bring it towards the inside. And my fingers go out. I'm using my inner hand, and my palm ends at the close to the inguinal. So get the fluid moving towards there. Your upper hand, your fingers can stay up, but your inside hand, your fingers will curve out so they don't accidentally grope that area. But your palm will just kind of side glide up and out and away. So you're directing that fluid from around the knee to move up and out. And I notice when I talk, I move a little fast, so move a little slower, a little more rhythmic than me. I don't have any music on when I'm talking. So that's it. Just want to do lots of it. Get right behind the knee and bring that fluid up. Bring it up, bring it up, and then work the 4 corners of the knee. Bring that up and then milk that to the inguinals. And same thing, if the hip was sore, you can come around the greater tuberosity, that hip bone, acetabulum, and bring it forward. So it's that one way you could pump first and then bring it in. Okay. You can blend a little bit of effleurage at the end. Make sure you're super light coming down. Pressure going up, move the fluid. Come down with superficial pressure. Pressure coming up. So at the end of the session, I might lean back and really get some length into the tissues. An effleurage, light coming back down, and lean back for a little traction. All right. That's leg. Hi, so assuming that we've just finished the 4 quadrants of lymphatic drainage being opened and that we've done our abdominal massage, if they've opted into that, we've now turned the client over, put a pillow between their knees and ankles to keep the hips in line, and have a pillow under her head, and her arm, if they're comfortable, is up so that we can work lymphatic drainage. So we'll start with a little bit of oil. We're working the lower quadrant around the ascending colon, pulling through below the hip bone and on the posterior side, contouring the hip bone as well. And you might do this at least half a dozen times with flat hands, slow rhythmic pressure, and maybe up to 3 dozen times if they're looking for body sculpturing or if they're bloated, which honestly I wouldn't doubt if at least 60% of people, possibly even as high as 85% of people, are bloated most of the time. So this is a wonderful thing that we can help with. After you've done maybe up to 3 dozen of these scoops, we're going to scoop under the rib cage of the gallbladder, the liver, the hepatic flexure, and the posterior below the ribs as well. Flat fingers and palms. Moving all of the fluid up here. And as you begin this contouring, you can really start to see the contour happen. And the more we drain, the more you'll see length in the digestion, which you might hear more activity because more room makes for more optimal activity. You might just hear some gases, some flatulence, and encourage that. Wonderful, we got things moving along. We got a nice heavy blanket, don't worry about a thing. From here, we're going to take the finger, the thumbs on one side and the finger on the other side, and milk that fluid now up as your bottom hand does a little retraction, maybe holding just above the hips. And then use your opposite hand and contour a little bit more on the supine side, on the front of the body, and retract with that backhand, offering some length in the torso, length in the digestion. And as you pump the lymph now, really start to have a little bit of milking movement with it. And you can come back and milk through these quadrants and then milk it up. And from here, let me see if I can make an adjustment so you can see just above the arm. There we go. So after pumping through this area, take it all the way up. I'm just going to hold back and pump with your inner hand into the axillary and subaxillary. The back hand is holding the arm. So as you're milking that fluid, you're able to offer some counter support. And I didn't get oil, excuse my loss of contact there. I didn't get oil up on the top, so it's not gliding well. So we'll do that again. We're gonna pump, 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 and milk it all the way up. And as you milk up, use your inner hand to pump it and drain into the axillary, into the subaxillaries. So we've drained some through this quadrant, some through this quadrant. And we've taken that extra interstitial fluid that might be lingering between the ribs, even behind the hip bone near the sacroiliac, and sweep it up. And you could really see that torso start to have some beautiful contouring happening. There's some beautiful body sculpturing where you can see the cut of the hip bone, the cut of the rib cage, and a nice long torso. So as you pump that up, let your fingers really work all the way up. Offer posterior support through the bicep so it's not awkward for them. And come back. And you could do this again if you wanted to emphasize more contouring, more body shaping. You can even vibrate and hold slowly through an area. Pump through that through that lymph nodes channel, and then all the way up. All right. So you would do this to both sides. We always start with the right side because that's the ascending colon, and then the transverse colon. And by the time you get to the other side, you've got such good irrigation moving that there's natural peristaltic action, that muscle squeezing. I don't know where we can see my hand best. There we go. That peristaltic action is the muscle kind of spasming or crunching together that happens through the colon that really helps to dislodge all the old hard stuff off of there. So body sculpturing, really, really effective. A great thing to do regularly to open up, to release bloating and congestion in the digestion. And it couples really nicely with the abdominal massage. All right, enjoy. Next part. All right, so I wanted to talk about lymphatic drainage to the breast tissue. The mammary glands themselves don't get squeezed like the rest of your lymph nodes generally do when you bend an area. So you'll notice that the rest of the body has channels of lymph nodes that conglomerate around the bendy areas. And that's why we pump those channels open and then we milk through those channels to really open them up. So in general, things that are great for the lymphatic system are anything that bends those joints. That's why yoga's great, and the rebounding or trampoline jumping or cycling or swimming or brisk walking where you bend your elbows and really move your hips. All of those things are draining your lymphatic system because you're moving your lymph as you bend and squeeze those limbs. Well, that doesn't happen to the breast. So unless you're doing manual breast massage, which we all should be doing to ourselves, especially around our own moon time, around your menses, your menstruation, is where you'll have maybe some swelling of the interstitial fluid of those mammary glands, and you can help drain that area so that you have less tender breasts. Also, if you had a mastectomy, this is great post-mastectomy work, as when they've removed the breast, they often remove a whole channel of lymph nodes in the mammary glands, but also in the axillary and the subaxillary. And so you'll see some women wearing stockings on their arms, or hear about that perhaps, as the arm tends to swell because there's no draining happening to that channel. So when they're sleeping, we want to maybe pad the side. Assume that this lady here has got a breast augmentation done and they've removed the left breast. So we've put a little bit of supportive padding on that side, and that will really allow a little bit of that inclination to encourage drainage to the opposite side. We're going to start off by draining the swelling. So assume that we've already opened up the main lymphatic quadrant, and if you were to specialize and just do this or incorporate it into your massage, either way, you're going to work from the side that's had the lymph nodes removed or had the congestion removed, had the congestion because the lymph nodes were removed. We're going to work to the opposite side. So we'll just allow the elbow to flare out to make a little bit of space, and we're going to scoop from the lymph of the axillaries and the subaxillaries in the inner bicep and the side of the mammary glands, and just gently bring through there. So I'll say right now that what I feel, I haven't felt yet through her body, not even in her knees that were a little bit tender and can be a regular swelling area for her when she overworks it. What I do feel here is like a little bit of tapioca pudding, or maybe like string of pearls, bump, 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 bump. Especially right through this upper chest area. So in that area, I might go slower, and I'm just pumping very light and very slow. 1, 2, 3 compressions, 4 compressions. Maybe it takes me 5 or 6 compressions to get to the sternum. So I'm sweeping towards that breastbone. And if she's had those lymph nodes removed, you would feel that, those little grapes under your fingers or tapioca pudding. She might be a little sluggish in this area as she's into her menopausal years now, and maybe she's not active with doing lymphatic drainage to her breasts as well. Maybe there's dirty hormones from the environment, from our diet, from our laundry soaps. There's so many culprits to look into, I would encourage. So you can see now I've swept it, maybe half a dozen, 3 sets of half a dozen palpations, and I did at least 3 sets. And then I started bringing it across to the healthy tissues, again, assuming that this has had a mastectomy. And now I would start to drain and palpate into the subclavicular, below the clavicle, and the subaxillary on this side, which I'm just going to show by bringing the arm up, that I'd be palpating right into the armpit. So you can leave that arm up and cup from that side and bring it across. I can also pump this side open of the mammary glands with my palm. And then I'm going to show, so do you mind if I undrape part of your breast tissue and keep,
Sure.
thank you, keep the areola covered. And we're just going to palpate that lateral aspect of the breast tissue. So if they had larger breasts, you'd hold above and below and into the chest area and just give a little securing of the draping. Then keep this hand there as this hand comes upwards, so you're not cupping the tissues, but keeping your palm flat and open and thumbs away from the area. And I'm just pumping lymph in through the mammary glands and bringing it up across that thoracic duct. And I can pump a little bit into the armpit with each alternative stroke. So really opening up both channels. If I knew that they'd taken lots of lymph out of here, but maybe they left some here, I could flare the elbow out even more and pump that channel and drain it there. Or if it was just the case as it is with this client who has not had her breast removed, but just happens to have sluggish lymph in this area, again, I can use these two deep channels of drainage into the axillary and subaxillary and into the main lymphatic ducts of the thoracic duct that'll take it through the subclavian vein back to the heart. Okay, so that is mammary glands, and then you could also do the medial aspect of it, which you can make a V. You don't even need to have a second draping. If you just make a V and keep the areolae covered, keep both nipples covered, and just take palpations through the cleavage area and bring it across into the lymph of the thoracic duct on the opposite side and into the axillary glands. So we're pumping under the collarbone and under into the armpit. And you could sweep the cleavage, but you're going to find that most of your mammary glands are actually on the lateral aspect of the breast tissue. On the outside is where you tend to find more of the mammary glands that might have a buildup to them. Certainly as you're palpating anywhere that you feel, and I don't feel any in her cleavage area. Where I feel them the most for her is right here. It's so, do you want to feel what I'm feeling?
I know what you're feeling.
Yeah, she knows what I'm feeling. And then if I do this side, she has some, but for whatever reason, her left side is, oh, there's, yeah, okay, I do have some here too. Her left side might be a little bit more congested. These are a lot smaller, but here these are a little bit larger lymph nodes, so a little bit more congestion, whether the left side is the weaker side in general. Generally, we have a dominant side that we overuse that might have a lot more drainage happening because it's overused, and then our sluggish side, because it's not bending as much, might have a little less drainage, but maybe there's some underlying conditions here that I'm not aware of. In German New Medicine, they talk about the, I believe, left breast having to do with mothering issues and the right breast having to do with your children. I think I got that right, but I might have inverted it, so look it up. Don't quote me on that, but I find that fascinating. Anyways, the emotional links of how we might be storing things on a physical level is always worth looking into. That was mastectomy work. Thanks for your time. Take care and be well. As we're coming to the end of our care today, we'd like to finish with closing and reviewing in highlight. So once you went through the full body, you might just close by stroking their scalp or by grounding their feet and squeezing them and saying their name to bring them back. So we would have spent an extra bit of time on whatever, and we're going to talk about that with what came up with this client today. So we'll say, Miss Jane, your massage has come to an end for today. We hope that you've enjoyed this time. I'd like to just talk about the things that were congested, the work that was done that was a little bit extra to really support your natural detox and toning of the body, and some home care advice that you can do to help yourself out a little bit further. So soothing strokes, whether it's to the scalp as you're talking or squeezing the feet. You might figure out what their favorite is or just ask them, what would you prefer, as I just give you a little bit of closing. So Ms. Jane, you have the option of having scalp massage or feet as we close and just give a briefing to the extras and how you can support them. And Ms. Jane has said scalp because I'm already here. Yeah. So we did a little extra to the knee today because she's been playing pickleball and really felt her knee this morning was a little bit tight and tender. So we did some drainage to that area with extra crossover strokes behind the knee at the popliteal glands and in front of the 4 quadrants of the meniscus as well. We also did some extra work to the mammary glands and to the subclavicular and the axillary glands because the lymph nodes were swollen around the breast tissue. Home care for those 2 areas might be for the breast tissue, and I'm going to back away and lose contact as I talk to the video instead of tending, but you would continue to talk and tend to your client. So I wanted to show that for behind the knee, some home care advice might just be take a bolster and roll it up and put it behind your knee and lean into something and release, and lean in and release, and then lean in and hold. So I'm stretching the knee, the quadrants, not the quadrants really, I'm stretching the tendons and the ligaments around the knee that are holding the joint in place. And when you've overused something, the swelling of the tendons and ligaments can capture the joint a little bit too tight for interstitial fluid to flow through naturally. So this pumping technique of having something between the knee, whether it's a ball or a water bottle or towel rolled up like a bolster, and just lean in and out a dozen times can really help to drain that area. And then whether it's a dozen times or 3 times, then just lean in for a really good stretch for maybe 1 to 2 minutes. So that bolster's right behind the knee, and that just makes a little bit of space in the knee. That's a great activity to do to release pressure on the knee. Another thing might be to have somebody grab your ankle and traction, or maybe have an inversion table if you're so fortunate and you can hang upside down or on an incline, and that inversion would allow some traction. And when we have traction, we have separation, and it makes length and inviting more interstitial fluid and more circulation to move through that joint itself. For the mammary glands themselves, it's not about stretching the area, but rather why are these areas built up? It is around the lungs, it's around the heart, and it's also breast tissue. So if there's any heart stuff going on in the family, maybe there's inherited heart weaknesses there, perhaps there's a lot of grief and pain, and so there's been a lot of maybe crying with the grief that has tightened things up in there. Maybe there's respiratory problems, maybe they grew up with asthma, or they have COPD now, or some kind of chronic emphysema, some lung dysfunction that calls for a little bit more attention to that area, and that's why we'll have swelling of lymph tissue. Maybe it's just dirty hormones and dirty breast tissues, whether it's from having too much creams in our diet or having too much, we could get into, that could be a whole nother video, but that's something to look into, is if it's coming from hormones. Is it actually your hormones out of balance, or are your hormones out of balance because of perhaps too much of certain foods or too much of certain things in our environment that might be being challenged in this area, whether again that's through lungs, through breast tissue, or, and also we just need to massage our breasts. So I was saying the homework here is not so much about stretching, but it's about elimination, an elimination diet where we're looking at what things can congest this area in hormones, but also, like I said, with grief, that might have been a piece of it, and then how we can open that area up. So really learning to massage our own breast tissue. This is a great thing to do, circular petrossages, avoiding the areoli, so avoid the nipple itself, but everything else is like circular rotations, and give a little bit more into the armpit and under the clavicle. So that's where we'll drain more. So that would be homework for somebody. I would literally show them how to massage their breast by doing mine in front of them. It's very important to see that. It doesn't have to be unclothed, but this can be really helpful to help somebody move forward with something that they've heard about but maybe haven't integrated into a healthy habit in their daily. The other things that we noticed, a little bit of bloating in the digestion, that's right. So she was bloated, particularly in the small intestine, which is where we absorb nutrients and eliminate waste from, or really absorb 80% of our nutrients from. So we talked about having more sprouts in the diet, and maybe more ferments, more probiotics that can help break things down. Everything from fermented lemons to kombucha or sauerkraut or kimchi or sourdough bread. All of these things, and changing up the ferments really changes the different strains of probiotics that can assist in a healthy bioflora, a healthy gut flora. And we also talked about clockwise work of manually detoxifying the area with the abdominal massage that we did. And the palpations, everybody could palpate their 4 quadrants, right? You could do this lying in bed every single night. If you feel bloated at nighttime, just slow, I'm going too fast, but doesn't matter. Slow or fast, a rhythmical, gentle massage to the 4 quadrants. And having 2 hands, you could do 2 sides of your own body at once while you're lying down, relaxed, without any muscles in the abdominal region engaged. So that would be great support, other than the probiotics and the sprouts or the healthy enzymes to help move things along through the digestion. Also, the last thing I'll give about bloating in the digestion is we're holding in that area because maybe things aren't moving in general. And so how can we get things moving is maybe by slowing ourselves down to allow there to be a natural homeostasis. Our body is made perfectly and wants to find balance. So if you're eating, sit down, be the Buddha, be mindful, give thanks for your food, for where it came from, the color, the farmer, the nutrients that you're about to receive into the body. No matter what you're eating, we should all be thinking these positive thoughts, and then only allow positive thoughts to enter the dinner table. So there's no talk of anything stressful at the dinner table. As a matter of fact, very little talking is welcomed. But if you are going to talk, keep it positive, and make sure you're sitting to eat and that you're chewing at least 3 or 4 times longer than you think you should. Those are all healthy habits that can help reduce the bloating in the abdominal region. That manual massage, the sprouts, all the high enzymes and high fermentation foods, and also being mindful to sit, to give thanks, to think only positive thoughts as you're eating, and that can help you receive more nutrients and less, I was going to say BS, but less stuff, less unneeded stuff. Anyways, I hope this all proves to be very helpful. I wish you all a wealth of health.